Hello, I'm Dr. Jiang Zheng, the PCSO Bulletin Case Report column editor. In this summer issue, we will feature an adult case treated by Dr. Thomas Shipley in his private office. Dr. Shipley is an orthodontist and an adjunct faculty member at the ATSU Arizona School of Dentistry and Oral Health postgraduate orthodontic program. The patient is a 41-year-old woman referred by her general dentist for an anterior crossbite. She reports food impaction and clicking in her temporomandibular joints without pain. She had previous orthodontic treatment as a child and has complicated medical history, but she has been given medical clearance to begin orthodontic treatment. She asks it being done as quickly as possible. Upon clinical examination, the patient presents with balanced facial thirds, reasonable small arcs, and there is no significant facial asymmetry. Intraorally, she has class 1 canine and molar relationships, 40% overbite on the maxillary right central incisor, but less overbite on the maxillary left central incisor, and a downward right to left cant of the mandibular anterior teeth. There is a crossbite of the maxillary left lateral incisor. A maxillary diastema is presented with moderate mandibular anterior crowding. The mandibular dental midline is deviated to the left by approximately 2 millimeters. Because of the anterior crossbite, there is a slight CRCO discrepancy during the functional evaluation. During a comprehensive TMD examination, the reported bilaterally clicking of the TMJs is not discovered. Very slight palpation tenderness is noted in the masseter and temporalis muscles bilaterally. Initial TMD tomographic rendering reveals mild flattening of the left condylar head. A panoramic radiograph examination shows the absence of Wisdom teeth, generalized posterior restoration with a full crown coverage of molars number 14 and 18. Most of the cephalometric measurements are within the normal range. The following treatment options were presented to the patient. Option number 1, comprehensive fixed orthodontic treatment with the extraction of the mandibular left central incisor and using class 3 elastics and the leveling of the anterior occlusal plane. Option number 2, limited orthodontic treatment using clear aligner therapy to address the chief complaint by closing the maxillary midline diastema but not correcting the anterior crossbite. Option number 3, comprehensive clear aligner therapy treatment with lower interproximal reduction to address the diastema and anterior crossbite. Option number 4, TMD splint therapy to address the headaches and the local muscle tenderness, followed by no orthodontic treatment or one of the above options. If you are interested to see how this case was treated and how long was taken to finish this case, please go to find the PCSO Bulletin 2019 summer issue for details. Thank you.